Sir, let her. Oh, you want to answer? Okay, please, sir, please. Okay, let her answer. If she doesn't, then you can answer. Obviously, you'll answer. Not what with my limited knowledge of medicine, with the investigation which you showed. Definitely myopathy. And treatment was altogether different with steroids and all those things somebody else has started. You started giving vitamin D as well as vitamin A and B12 also. He started dramatic improvement. Fine. But with the investigation, if you show, could you show me the investigation? First, initial was like long list, and that where everything is there, all inclusive. Yes. Yes. With vitamin D. Vitamin D is 9.9 nanogram, and on 8th of March, that still shows that there is severe hyperhidrosis of vitamin D. 25 hydroxy cholecalciferol is very usually because 25 is normal nanogram. Severe. And what about the creatinine kinase CK? Did you do? Where is it? Okay, 116. And alkaline phosphate, is it elevated? Magnesium sulfate, magnesium also is slightly low, no? In this. So, what I understand, the hypopignosis was there in the very first, on the first day of his visit. Why this is not hugely circled, the diagnosis itself, they put huge, even if we forget, there will be huge marking, there is a difference. 25 is normal as far as I know, 25. And 9 is very, very low. Why that circle was not put? And why did you give aquasol? Aquasol, as I understand, is vitamin A. Where does deficiency, vitamin A deficiency has come? Sir, you can answer.
Sir, I will tell you in sequence. Actually, if you focus on this slide, you will miss the real case. Patient he has developed the symptoms in August. Hardly 3 days of fever, received antibiotics, subsided. After a week, he started getting the arthralgia, the minimal body aches. Later, because of persisting joint pains. So that means that he never had any swelling of the joint, never had any wound. So classically, he never had arthritis. He has only arthritis.
That's ruled out.
No, sir. This is the crux of the problem. So, without asking the detailed history, the rheumatologist, because the persisting joint pains, the rheumatologist straight away treated this patient as juvenile arthritis, that is juvenile idiopathic arthritis with systemic onset, because she considered it as a fever followed by this one, which is a bit higher for this long came back in severe arthritis. So she presumed this one as systemic onset of the idiopathic arthritis. She straight away started methotrexate and steroids.
It is more common and it lasts to this arthritis lasts up to 1 year also. Being a small change is not able to tolerate. I support this arthritis for 1 year for children. It is circulating, when you have small joints, that is more common with children. They started early steroids, that is induced myopathy.
So, because of that, she presumed that this might be due to the juvenile rheumatoid arthritis, and she started on methotrexate and steroids. Initially, there is a improvement because of steroids. The arthralgia has somewhat settled down. He was able to go to school, but slowly his muscle aches are increasing, and he had a history of fall while getting into the bus and while getting down, and also while climbing the stairs. His classroom is in the 4th floor in that school, and they won't have any lift. So he has to climb to the 4th floor. So he used to have all sorts of difficulty. He stopped going to the school, and he has gone to the doctor again and they have increased his steroid doses. So because of that, his pain still worsened further.
In the proximal group of muscles are weak
So,
to 4 or 5.
steroids will be, steroids will always cause the proximal muscle weakness. Okay, so that is the first thing. Our first thing is drug-induced one. So we have not given, of course, there are vitamin D deficiencies there and B12 is there. We need to consider it. We have to treat. We have to treat. So the first thing is that one is the drugs that has caused the myopathy constriction. Because in vitamin D deficiency or vitamin B12 deficiency, tenderness of the muscles will be there. They may have some weakness, but they never have the tenderness. Here he has tenderness. If you catch hold of the muscle, then he immediately says that I am pain. So there is a pain. So he has the deficiency, but this is not the first one. So as the explained book, Taylor says that
CK is normal. CK is normal. Myositis is normal.
Sir, no, sir, not all cases will have, because it is severe myositis. Then you will have dermatomyositis or other myositis you can have. In myopathy cases, it is very minimal, right? Or it will be normal. So that can explain this one. And once we stopped it, because he is on the 10 mg or 20 mg of the prednisolone, so that by immediately after stopping the drug, slowly he started feeling better. After that, we have this deficiency. Why we have given the vitamin A? There is no absolute indication. There is no absolute indication for it, because on the third day, I have treated a good number of the drug-induced steroid-induced myopathy, especially at the very high doses, the patient is on pemphigus, and in those cases, they used to give the 80 mg of steroid along with other cyclophosphamide and other drugs, including the newer ones. So in those cases, the response is not so robust and so quick. But this boy has recovered, has a drastic
immediately
on the second day and third day. So that made me to think, is it vitamin D, associated vitamin D deficiency that has facilitated this fast recovery? So okay, so we are not testing the vitamin D and other things. Okay, let us do some other vitamins also. Maybe in subclinical state, subclinical deficiencies might be the way of testing. So what is there in giving the 2 lakh units of vitamin supplementation? That's why I kept Tacosol and also the multivitamin combination.
Excellent. Fresh round of applause for that.
Myopathy is also because myositis is part of the myopathy. Myositis is also part of myopathy, and it will also have pain. Yes, ma'am. Yeah, pain. When somebody is having the pain, it will affect the diffuse, and it will affect the reflexes and also the testing of power. So one thing. Regarding the PET scan, I want to tell one thing. Sir, I have after some dermatologist has ordered, and because sir, point of view of dermatologist might be, they thought it is juvenile rheumatoid. They kept her on the proper dose. They kept him on a very proper dose as per the guidelines. In spite of giving the proper dosage, he has not responded. So that way they thought of looking for any other hidden things like tuberculosis or any other hidden malignancies. Maybe that might be the reason that pushed her to order for the PET scan. I thought this. So just I want to tell this one. This is one of the wonderful book, and from which I have learned the reasoning and thought process. This is the learning clinical reasoning. In this, it will teach you how the doctor is supposed to think and thought. What is thought process? What is the cognitive levels of thought process? What are different psychodynamic things? And what they all teach those things with the cases. 62 cases for this will be there in this book, in the wonderful book. 62 cases, that 62 cases, they will teach all sorts of things, and Evidence-based medicine is not a laboratory medicine. Is not a laboratory-based medicine. Is not a test-based medicine. Evidence-based medicine is a scientific medicine. That means that your whims and fancies, your likes and dislikes, and your whims and fancies cannot influence the decisions that you are going to make at bedside or at the lab or any other side. It is purely, it will assess everything, your history, your examination, your investigation, or your so-called intervention in the form of a surgery or invasive procedures. So, Bayes' theorem is very much hard on the evidence-based medicine. So, if you are analyzing something, it will be evidence-based only. So, the process of analysis shall be unbiased, and scientific. Here, the point is, the doctor has not elicited the history properly. They have not asked what are the joints that have been involved, whether you have any swelling, is there any redness in the particular joint, is there any warmth. These three questions that she failed to ask. Because of that, all this has happened. So never ever carry away by the weightage of the doctor who priorly attended by the previously. You apply your mind, you believe in your skills, and approach the patient with an independent, unbiased manner. So learn the thought process, how the doctor is supposed to think, how you are supposed to think in an unbiased way. With that, you can do good. And this boy, I am very happy, not because of presentation, not because of this presentation, not because of anything, but this boy is going back to school. I promised him, I will make sure I will go back to school. For the 11 years old kid, sitting at home ideally, not playing with some friends, it's horrible. It's horrible. Whatever needs we need, whatever needs we have, whatever technology we have, we should do every sort of thing to make that boy to go back to his school, to go back to his normal life. I strongly believe in that, what James Davis once said. Thank you.
Fantastic. Thank you for wonderful presentation, wonderful, and heartiest congratulations for the excellent diagnosis and treatment. The boy is fully recovered and going back to his school. What else do you want? So, always remember, we have to have unbiased way of accepting whichever go to the clinical knowledge. And as I rightly said, most erudite person, very learned person, he reads a lot. That's how you become the best clinician. You must read a lot. You have to be erudite. Okay, like a learner. And now the prizes. I hope the prize recipients are still hanging around. For the photo quiz, G. Mamata, 5 years old. Doctor G. Mamata, 5 years, second. Heartiest congratulations. We are not answering. What you would like to become after this year? Which specialty would you? Dermatology. Why? Wonderful. I thought you would go for medicine after all the discussion. You would be very because I would be very happy. They are disappointed. Okay. One more prize for Scientist of the Day, A. Pavani. Again, 5 years. A. Pavani. Yes, congratulations. Same question. What did you do? Obstetrician, gynecologist. Any gynecologists around here? Very happy to have you here. Thank you, sir. Would you like to say anything? So, I'm sure you have enjoyed the session and please come.